Movement patterns of the lower extremities. Structure of the hip. The hip is a ball and socket type joint. It is formed where the thigh bone, the femur, meets the pelvis. The femur has a ball-shaped head, and it fits into a socket formed in the pelvis, which is called the acetubulum. Large ligaments, tendons, and muscles around the hip joints hold the bones in place to help keep it from dislocating. The pelvic girdles includes two ilia and sacrum. It can help with forward rotation and backwards rotation, as well as lateral movements to help position the hip. The stability of the hip is increased by the strength of the ligaments involved. The ligaments that encircle the hips are the iliofemoral, the tibiofemoral, and the ischiofemoral ligaments. These ligaments, the iliofemoral ligament is said to be the strongest ligament in the human body. The ligamentum teres is a small tubular structure that connects the head of the femur to the acetubulum. What movements of the femur are facilitated by pelvic tilt? So pelvic tilt helps to activate core stability and is used isometrically to help engage as stabilizers. So pelvic tilt directions are posterior, anterior, and lateral. Femoral movements are flexion, extension, and abduction. The hip flexors are several muscles that brings the legs and trunk together to form flexion. Flexion muscles at the hips are the iliacus and psoas major, assisted by the pectinus, rectus femoris, sartorius, and tensor fasciae latae. Extensor muscles at the hips and the gluteus extensor muscles at the hips are gluteus medius, gluteus maximus, and hamstrings. Biceps femoris, semimembranosus, and semitendinosus. Help with the extension of the hip. Hip abductors. The hip abductors are the gluteus medius, which is assisted by the gluteus minius. They do not only move the hip, but they also help with rotation. The hip abductors are necessary for standing or for stability or standing on one leg. Hip adductors. These are the muscles that help support balance and alignment. They are stabilizing muscles that are used to adduct the hip, moving the leg or moving the hip towards the midline of the body. The adductor muscles at the hip are abductor magnus, abductor longus, and abductor brevis, assisted by the brachialis muscle.